diagnosing. Now, we have other things to discuss regarding melanoma and these other forms of cancer and some of the history behind it, maybe some of the statistics. But would this be a good time to introduce the video segment that you have that shows your biopsy of these various types?
I think this is a good illustration of what the typical patient might experience if we see a lesion that needs some examination, and I demonstrate that in this video.
Let's cue that up if we can.
Hi, I'm Dr. O'Donoghue from O'Donoghue Dermatology, and today I'm just demonstrating how I do a skin biopsy. So the first thing that I'll do is I'll just cleanse the area with a little alcohol pad. I'll localize the area with a little gentian violet pen, a blue pen, just to mark the area and locate it for when I do take a photo. I know exactly where that lesion is. I'll then take a little bit of 1% lidocaine with epinephrine, and we'll just slowly inject this into the spot. I'll tell the patient a little pinch and some burning. And this anesthetic works very well. It's very quick acting. The epinephrine also constricts blood vessels, which causes less bleeding. And that's adequate there. And then what I'll use is we just have a little specimen cup that I put the tissue in. It has some formaldehyde in it, which keeps that tissue preserved. And then I'll take just a little scalpel here. We use a little Persona blade, which is just a nice sharp scalpel. And I'll just gently take that lesion off the surface here. And I can show you here, if we turn the patient there, we just shave that right off the scalpel. Then I put that specimen in the bottle. Always labeling the bottle. And then what I'll use is just a little bit of aluminum chloride, which is a solution that just also coagulates those little blood cells. And then I'll use a handheld cautery device just to cauterize that lesion there. And then I'll place just a tiny Band-Aid on the spot along with just a little bit of polysporin or neosporin. And the patient's all set. So this is Morgan O'Donoghue from O'Donoghue Dermatology demonstrating a skin biopsy. Thank you.
What we know so far from your conversation so far, Dr. O'Donoghue, is that skin cancer can be and should be highly preventable, highly treatable. What's tougher, the treatment or the diagnosis or the treatment?
Well, the diagnosis can be difficult. There are some cancers, particularly melanoma, that are very unusual. They don't follow the rules. In fact, there's one variant of melanoma called a melanotic melanoma, which has no pigment at all. And I may find 2 or 3 of these a year, and they're presenting as just a pink bump that resembles a scar, and I'll ask the patient, where did this scar come from? And they can't tell me. And it's in a sun-exposed area, maybe on a very fair-skinned person, and I'll biopsy it, and sure enough, it comes back as a melanoma without any pigment. And so, although, again, that's very rare, that diagnosis can be very difficult. And then you can have other variations of melanoma, particularly one called lentigo maligna, which will resemble in many instances just sort of a large sun freckle. And the patient may tell you it's been there for a long, long time. Now, this particular type just trickles over the surface. It doesn't tend to be very aggressive, but it still is a melanoma. And so that's why you just really have to carefully look. One of the things, the tools that I use is this is a polarizing microscope. This is what we call a dermatoscope. And this dermatoscope, this has a series of special LED lights and a magnifier that allows me to look closer at the skin than any other regular magnifier I could have. And it actually illuminates the pigment and lets me see the borders and the actual integrity of the mole, and really gives me a leg up on examining my patients in the office, and I use it all the time.
That's an exam tool for you. for us regular folks who don't have your knowledge and expertise, you talked about self-examination. I suppose I could do a self-examination and get lucky and find something that would require you to look at or someone in your field. But what about areas that I can't see or really can't get to, like my back? How do I self-exam my back?
Well, nothing is going to replace a thorough exam by a board-certified dermatologist. But having said that, things can develop between your either yearly or your every 6-month exam. So what I really like to do is educate folks on how to do a proper exam. And what the best thing to do is, if you have a partner that can help you, particularly on your back, that's key, because it's very difficult to see your own back, and I find a lot of skin cancers in that area, particularly in men. In fact, one of the most common places for skin cancer in men is their back.
But the partner has to know what they're looking for.
Well,
also,
they do,
right?
and there's a variety of different pictures and handouts that I provide my patients in the office, but they're readily available online too, that specifically show you, exactly what melanoma and what the other skin cancers look for. So once you educate yourself as to what to look for, right? And again, these are available on my website. You can then start, and the way to start is in very good light. You need to be in your bathroom with very good light, and even a flashlight, and standing in that good light. You want to start with particularly standing in front of a mirror, and start from the head. Work yourself, work your way down, and it does take some practice. It does take some help, but at least it's a tool, and studies have shown that patients that look at themselves at home in between their visits have a much higher survival rate when it comes to diagnosing early skin cancer. So it takes some practice, but if you come into the office, I'll show you exactly how to do a thorough and proper exam. It's not hard.